Hello everyone, now let us discuss about 2023 CPT coding guidelines for cervix uteri. This comes under surgery, female reproductive system, and the CPTs that we are going to discuss in this session are 57,452 to 57,800. So the cervix uteri has following subdivisions: endoscopy, excision, repair and manipulation. The CPT range for endoscopy of cervix uteri is 57,452 to 57,465, and the CPT range for excision of cervix is 57,500 to 57,558. Next CPT range for repair is 57,700 and 57,720, 57700 and 57720. Next, coming to manipulation, the CPT is 57800. Now coming to CPTs for endoscopy. Coming to the CPTs for colposcopy. And for colposcopic examination procedures involving vulva, we need to see 56820 and 56821. And for colposcopy of vagina, we need to see 57420 and 421. Here we are going to discuss the colposcopy of cervix, including the upper and adjacent vagina. And do not report 57452 in addition to 57454 and 454 to 57461 because they are different. Coming to the first CPT, 57452, colposcopy of cervix including the upper and adjacent vagina. The next is 57454, colposcopy of cervix with biopsy of cervix and endocervical curettage. The next is 57455, colposcopy of cervix with biopsy of cervix. The next is 57456, colposcopy of cervix with endocervical curettage. When both biopsy of cervix and endocervical curettage are done, the CPT is 57454. When only biopsy is done, the CPT is 57455, and only endocervical curettage is done, the CPT is 57456. The next is 57460, colposcopy of cervix with loop electrode biopsy of cervix. The next is 57461, colposcopy of cervix with loop electrode colonization of cervix. And do not report 57461 in addition to 57456. And for computer aided mapping of cervix uteri during colposcopy, we need to use 57465. And for endometrial sampling performed in conjunction with colposcopy, we need to use 58110. The next CPT is an add-on CPT plus 57465. Computer aided mapping of cervix uteri during colposcopy, including optical dynamic spectral imaging and algorithmic quantification of the acetowhitening effect. List separately in addition to the primary procedure because this is an add-on code, and use 57465 in conjunction with 57420, 421, 452, 454, 455, 456, 460 and 461. Now let us see an example. A 21-year-old female is seen at the clinic today for colposcopy. The physician took multiple biopsies of cervix uteri. Here colposcopy and biopsy of cervix is done. So the CPT is 57455. Colposcopy of cervix with biopsy of cervix. Now coming to CPTs for excision. And for radical surgical procedures, we need to refer 58200 to 58240. Here, the first CPT is 57500, 57,500. Biopsy of cervix, single or multiple or local excision of lesion with or without fulguration. The next is 57505, endocervical curettage, not done as a part of dilation and curettage. The next is 57510, Quadri of cervix, electro or thermal. Next is 57511. Quadri of cervix. It is not electro or thermal. Here the procedure is cryo quadri, initial or repeated procedure. The next is 57513. Quadri of cervix with laser ablation. The next CPT is 57520. Conization of cervix with or without fulguration, with or without dilation and curettage, with or without repair, cold knife or laser technique. The next is 57522. Conization of cervix with loop electrode excision. The next is 57530. Trachelectomy or cervicectomy, amputation of cervix. The next is 57531. Radical trachelectomy with bilateral total pelvic lymphadenectomy and para-aortic lymph node sampling biopsy with or without removal of tube, with or without removal of ovary. And for radical abdominal hysterectomy, the CPT is 58210. This is radical trachelectomy. The next is 57540. Excision of cervical stump, abdominal approach. Next is 57545. Excision of cervical stump with pelvic floor repair. The next is 57550. Excision of cervical stump, vaginal approach. The next is 57555. Excision of cervical stump with anterior or posterior repair. Next is 57556. Excision of cervical stump, vaginal approach with repair of enterocele. And for insertion of intrauterine device, the CPT is 58300. And for insertion of any hemostatic agent or pack to control the spontaneous non-obstetrical hemorrhage, we need to refer 57180. Next is 57558. Dilation and curettage of cervical stump. Now let us see an example. Patient has a LEEP conization for CIN2. Loop electrical excision procedure. LEEP means loop electrical excision procedure. It is one of the most commonly used approaches to treat high-grade cervical dysplasia such as CIN1, 3, 2, 3, HG, SIN. So here LEEP is performed along with conization. So the CPT is 57522. Conization of cervix with loop electrode excision. Now coming to CPTs for repair. The first one is 57700. Cerclage of uterine cervix non-obstetrical. The next is 57720. Tracheorrhaphy, plastic repair of uterine cervix vaginal approach. Now coming to CPTs for manipulation. There is only one CPT, that is 57800. Dilation of cervical canal instrument. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.